Hi, I'm Lauren Masi, Doctor of Physical Therapy and board-certified orthopedic clinical specialist. I'm also the owner and clinical services director of Bay Area Physical Therapy and Lafayette Physical Therapy. Today we're going to talk about some breathing tips to prevent exercise pain from a physical therapist. So I'm not sure if you guys realize how involved our breathing system, our respiratory system and lungs are in all aspects of how we move during exercise, during daily life, and even our pelvic floor function. So we have our diaphragm. It's a dome-like muscle that sits right up underneath your rib cage. My hand is going to mimic the diaphragm. And then down here at the bottom, our pelvic floor, which is a bowl of muscles that sit just inside our pelvis. Now, when we breathe in, that diaphragm drops down. You can kind of visualize that as the air goes in, the diaphragm would drop. It would push down into our abdominal cavity. That can create some pressure. So in a good, healthy system, our body is very efficient at trying to maintain an equilibrium, and maintain equal pressure, that the pelvic floor actually drops down and relaxes a little bit as the diaphragm comes down and rises as the diaphragm rises. So it kind of acts as a piston system within our abdomen to maintain pressure. If we breathe poorly throughout our daily life or exercise, this can interrupt the system. We all know that when we take a nice big deep breath in, that oxygen gets absorbed into our bloodstream and we have nice oxygenated blood that gets carried to all of our muscles. If we are not taking good big deep breaths, this could result in muscle pain, spasms. You could have what some people refer to as that lactic acid buildup because we're not able to then take all the carbon dioxide and bad stuff and exhale it out, and we can't get nice, good oxygenated blood into our muscles. So one of the things that we can help with and we work on in physical therapy is, are you an efficient breather? So if you ever notice that when you take a breath, your shoulders rise up towards the ceiling, that would be an inefficient breathing pattern. That might also result in neck muscle pain due to you using what we call accessory muscles to breathe rather than our nice diaphragm and muscles that are meant to breathe. So what should happen, if you've heard of diaphragmatic breathing, or we also can refer to it as 360-degree breathing, where your air would fill your rib cage all the way around 360 degrees, like when you push up that umbrella and the hole opening on the bottom gets wider in all directions. We don't want it to just go. Another way that people breathe is more of like a bucket handle, where our chest goes, and that could actually result in back pain, because when I flare my rib cage like that to make room for my lungs forward, I actually tighten down and even maybe extend into a hinge in my upper back area. Also, if we end up keeping all of our air up in that upper rib cage area, our pelvic floor doesn't function as it's supposed to. Some people might notice this down the road in symptoms like incontinence or organ prolapse, and that's also something that physical therapy can help with. My number one take-home tip for everybody when you are exercising is don't hold your breath. So if you hold your breath, that diaphragm is held squished down, keeping pressure on all of those organs down on that pelvic floor. And again, you're not getting that good oxygen exchange. So a tip I like to say is to exhale during the hard part of the exercise. That's usually when people want to hold their breath anyway. So if you're doing something even as simple as a bicep curl, if you're lifting that weight, exhale as you come up. Inhale as you come down. That is just something to make you slow everything down, make sure you have good form, good breathing mechanics, and that you are oxygenating those muscles to the best of their ability. So no more breath holding. Now again, there are some caveats, of course, as there always are. One exception to any kind of bracing or breath holding can be if you are doing extreme weightlifting, boxing, or higher end sports like that. Obviously, most of us watching this today probably are not in that category, so please make sure you're breathing fully into that rib cage, exhaling during the hard part, no breath holding. And if you do need any help or would like some further assistance in how we can help your respiratory system and pelvic floor while you exercise, please reach out to Bay Area Physical Therapy today. Thank you.